So hypersomnia is in general a term that we use to describe excessive daytime sleepiness, where you have daytime sleepiness that's affecting your life on a day-to-day basis. We have all kinds of medical scales that we assess this formally, but in general, it's if you're too sleepy to function, and oftentimes that means that we could be not getting enough sleep. In this day and age, that's probably one of the most common causes. Secondarily, we might have a disorder of our sleep. Sleep apnea can significantly cause daytime sleepiness. It's probably one of the most common causes. And then sometimes we can't find out what's causing it, and that's called idiopathic hypersomnia, which means we can't find a good cause for it. What we usually do is we do an overnight sleep study to rule out sleep apnea as a cause and to ensure that the patient's getting adequate sleep. And then we can do a daytime test. And that daytime test technically is being used to rule out or in narcolepsy, which can be one of the causes of hypersomnia. And it's a series of 5 naps. And we say, how long during these naps do you fall asleep? And what stages of sleep do you go into? Do you go into dream sleep, which we typically don't do during the daytime if we don't have a disorder like narcolepsy? Weight and stress and all these other things can affect fatigue and the feeling of tiredness. And that's a little bit different than sleepiness. So I usually say fatigue and tiredness is a sense of, oh, I just want to sit down. And sleepiness is, oh, I cannot stay awake. I feel like I'm falling asleep. So they can often be intermixed and it's hard to tease them out. And oftentimes people actually have both. Well, surprisingly, caffeine can be used for daytime sleepiness within a reasonable amount. The first thing we do again is to sort out, is there a treatable cause? Sometimes, and most of the time, it's often extending sleep time. It's treating comorbid disorders such as depression or anxiety. And then sometimes it comes to having to treat with medication, and that is often stimulants, which have a lot of side effects. So we have some safer stimulant medications such as modafinil and armodafinil that are out right now, but this is an active area of research trying to find some new, better medications that may have a better side effect profile. Some of those medications are a new generation of antihistamine, or something that blocks histamine receptors that can actually cause wakefulness, unlike the normal antihistamines that make us feel sleepy, right? We think of those as making us feel sleepy. There are some new ones out that can actually make us more alert. So whether there's a cure for hypersomnia is honestly dependent on what the cause of it is. So if it's caused by sleep apnea or too much caffeine at night that's helping you have fragmented sleep, or alcohol at night, then it can actually be cured. But if it's truly something called idiopathic hypersomnia, then we tend to have to treat it rather than cure it.